Individuals over 60 may have an item in their refrigerator, which has been consistently regarded as healthy, that could insidiously elevate their risk of a stroke during sleep. Absence of chest pain. Or forewarning, one moment you are well, and the next, you are slurring your speech, unable to elevate your arm, or experiencing difficulty maintaining your equilibrium. As a neurologist, I have observed this occurrence in numerous elderly individuals, not attributable to smoking or poor dietary choices, but rather due to the consumption of a vegetable that instigated a perilous chain reaction within their aging physiology. We have all been advised to consume more greens, and that veggies serve as medicine, yet, there is some aspect that remains unaddressed. In elderly individuals, the consumption of specific vegetables at inappropriate times or in conjunction with prevalent drugs may elevate the danger of cerebral hemorrhages, thrombus formation, and abrupt hypertension surges. Today, I will elucidate 9 prevalent veggies that may insidiously impair your cognitive function, and how to make more informed dietary choices without relinquishing your preferences. The final vegetable on this list is one that many seniors consume weekly, and it may pose the most risk of all. Prior to commencing, if you have not yet subscribed, I suggest you activate that button and enable notifications to ensure you do not overlook any health advice tailored for you. If you appreciate this video, please enter 1 in the comments. If not, please enter 0 to indicate how I might enhance the content for you. Spinach, the duplicitous ally of your intellect. For decades, spinach has been regarded as one of the healthiest vegetables, rich in iron, magnesium, and fiber. It is the centerpiece of salads, green smoothies, and accompaniments in senior meal programs nationwide. However, the startling reality is as follows. For seniors, particularly those aged 65 and beyond, spinach, if consumed improperly or at inappropriate times, may subtly pose a risk to cognitive health. Allow me to elucidate. With advancing age, our blood vessels inherently diminish in flexibility. Arteries that were formerly pliable and reactive become increasingly inflexible. Moreover, the ubiquitous use of pharmaceuticals such as calcium supplements, vitamin D, and antihypertensive agents significantly compromises the equilibrium within your bloodstream. Spinach, rich in oxalates, is a naturally occurring substance that binds with calcium in the body. In younger, healthier bodies, oxalates are typically excreted with minimal difficulty. In older persons, particularly those with diminished renal function or those consuming elevated quantities of calcium or vitamin D, oxalates may build, resulting in the formation of calcium oxalate crystals in the circulation. This affects more than just your kidneys. It can initiate the hardening of arteries, especially the delicate ones that supply the brain. The constricted veins elevate the likelihood of microclots, minuscule obstructions that, over time, can impede oxygen supply to cerebral cells. When that clot enlarges or shifts marginally, it can precipitate a complete ischemic stroke, resulting in the inability to lift an arm or articulate a spouse's name upon waking. I would like to discuss one of my patients. Mr. Harold Brenner, a 76-year-old retired firefighter from Milwaukee, has consistently maintained discipline over his health. Each evening, consistently, he would prepare a spinach salad adorned with feta and accompanied by a slice of whole grain toast. He also consumed vitamin D and calcium tablets to maintain bone strength, as he informed me. For years, he was convinced he was acting correctly. However, one cold morning, Harold awoke differently. He was discovered slumped over his kitchen table. His coffee was spilled. His words were disordered. He experienced an asymptomatic stroke overnight, characterized by an abrupt loss of speech and motor function, without chest pain or migraines. The scans indicated arterial calcification, rigid, constricted cerebral arteries, while the blood analysis demonstrated high levels of calcium and oxalate, constituting a concerning combination. The probable catalyst? Consumption of spinach at night in conjunction with prolonged supplement usage. His body had silently established optimal circumstances for blood clots until one ultimately developed in an inappropriate location, obstructing blood flow to a portion of his brain. Harold endured, however he no longer operates a vehicle and ambulates with support. What is the most challenging aspect? He said to me, tears in his eyes, "Doc, I was merely attempting to act in a healthful manner. I was unaware that my salad could be harmful to me." This serves as a poignant reminder that even beneficial practices can become perilous if not adjusted to our age and health circumstances. Here is what I would for you to derive from this. Individuals consuming calcium or vitamin D supplements, or those with renal or cardiac conditions, should restrict spinach consumption to the morning and consult their physician beforehand. Do not amalgamate it with vitamins unless advised by a medical professional. Do not presume that an increased intake of greens invariably correlates with improved health, particularly after the age of 65. If this astonishes you, anticipate the revelation of the subsequent vegetable, which is frequently lauded for cardiovascular health but may induce cerebral hemorrhage rather than clotting in the elderly. Let us discuss broccoli. If you are still viewing and find these insights beneficial, please comment 1 below to indicate your support. Let us go to the second point. 2. Brassica oleracea var. Italica. Beneficial for cardiovascular health, although not suitable for all individuals. Many of us were instructed during our upbringing to consume broccoli. It epitomized health, abundant in fiber, antioxidants, and vitamins. And for justifiable reasons. Broccoli is rich in nutrients that promote cardiovascular health, diminish inflammation, and combat disease. However, what if I informed you that for numerous older persons, particularly those on cardiac drugs, broccoli may insidiously be a significant risk factor for cerebral hemorrhage? It is not concerning the broccoli itself. It pertains to the internal composition and its interaction with the aging body and the numerous drugs that many seniors consume daily. Broccoli is rich in vitamin K, a fat-soluble vitamin crucial for coagulation. In younger persons, this vitamin facilitates wound healing and mitigates excessive bleeding. However, in elderly individuals, particularly those on anticoagulants such as warfarin, Plavix, or aspirin, vitamin K can induce a precarious and potentially hazardous imbalance. Excessive or irregular intake of vitamin K can disrupt these drugs, resulting in blood viscosity that is either excessively thick or excessively thin, often without noticeable symptoms until it is too late. I would like to recount the narrative of one of my patients. Mrs. Clara Newton, 82. A retired elementary school educator from Pennsylvania, always prioritized her health. She adhered to her physician's recommendations, consistently took her medication, and each evening prepared a bowl of broccoli cooked with olive oil and lemon. "It preserves the youthfulness of my heart," she would assert with pride. She was unaware that her everyday consumption of seemingly benign broccoli was gradually affecting her blood-thinning medicine. Her blood exhibited instability. Her INR, a critical indicator of coagulation, varied perilously and unpredictably. One afternoon, with a slight headache and abrupt disorientation, Clara fainted in her living room. In the emergency room, imaging studies indicated that she had experienced a hemorrhagic stroke, characterized by intracranial bleeding, not attributable to trauma or hypertension, but rather due to her blood's inadequate clotting ability. What was the initial inquiry posed by her physician? Has her dietary regimen undergone any recent modifications? Upon hearing her daughter mention the broccoli, I felt a profound sense of dismay. Not due to the inherent qualities of broccoli, but because even a nutritious food, when misinterpreted or unregulated, can disrupt the equilibrium of a delicate body. The interaction between vitamin K and anticoagulants generated a covert crisis, resulting in significant life changes. Clara endured, yet she now ambulates with a walker and her speech has become more deliberate. She now shares her narrative with fellow elders in her neighborhood, conveying a straightforward message. Do not presume that nutritious food is innocuous, particularly at our age. This is the reason consistency and awareness are significant. If you are on anticoagulants, you may consume broccoli, but it is imperative to maintain constant quantities and consult your physician. Abrupt fluctuations in vitamin K levels can render your prescription ineffective, perhaps resulting in perilous blood clots or cerebral hemorrhages that may abruptly compromise your autonomy. Bear in mind that our blood vessels diminish in thickness and strength as we age. A minor hemorrhage in a younger brain may be managed, but, in individuals over 70, it might result in irreversible loss of memory, speech, or the capacity for independent living. If you are listening to this and considering that you consume broccoli frequently while on blood thinners, be calm but take appropriate measures. Contact your physician. Regularly monitor your INR levels. Monitor your dietary intake, and do not presume that a heart-healthy food affects individuals uniformly, particularly those over the age of 60. This narrative should indeed evoke a sense of unease. The objective is not to instill terror, but to foster awareness. Next, we will discuss a vegetable that appears innocuous and refreshing, however can insidiously dry your brain overnight and disrupt your blood pressure during sleep. Indeed, we are discussing romaine lettuce. What I am about to disclose may astonish you further. 3. Romaine lettuce, low in calories yet potentially hazardous at night. Individuals over 65 are likely to have been advised at some stage that consuming a salad for dinner is a prudent and healthful option. Illuminating, low in caloric content, and gentle on digestion. This is logical, particularly when weight control and cardiovascular health are essential concerns. However, there exists a reality that most elders are seldom informed about. The seemingly innocuous bowl of romaine lettuce consumed at night may insidiously predispose you to a stroke by morning. I will elucidate the rationale. Romaine lettuce, although abundant in water and fiber, also functions as a natural diuretic. It subtly encourages your body to expel water. In a youthful, well-hydrated individual, this is little perceptible. In older adults, particularly those on antihypertensive drugs or diuretics, this mild fluid loss may suffice to induce dehydration, especially during the night. The majority of individuals perceive dehydration as a sensation. Dehydration, xerostomia, exhaustion. In older persons, the indicators of dehydration are nuanced and frequently overlooked. Your body no longer signals thirst in the same manner as it did in your youth. What about your blood vessels? They depend on adequate water to be open, flexible, and capable of transporting oxygen to the brain. During nocturnal dehydration, even modest cases result in increased blood viscosity. Consider it analogous to syrup flowing through delicate, deteriorating conduits. Thicker blood can lead to the formation of tiny clots, particularly if one is predisposed owing to atrial fibrillation, vascular illness, or the use of several drugs. These minuscule clots may initially go unnoticed, however, a single misstep or fluctuation in blood pressure during sleep might cause the clot to get lodged in the brain, abruptly obstructing blood flow. That precisely occurred with my patient, Mr. Leon Carter, a 75-year-old retired factory worker from Indianapolis. He was in quite excellent health, undergoing treatment for hypertension, and, like many of you, he was attempting to maintain a clean diet. Each evening, he prepared a substantial salad with romaine lettuce, cucumbers, and a vinegar dressing. He avoided substantial meals, engaged in daily exercise, and remained active in his church. One morning, Leon's wife discovered him disoriented, having difficulty articulating words, with diminished strength in his right arm. He experienced a little stroke while asleep. The hospital. Laboratory results indicated slight dehydration, elevated blood viscosity, and minor electrolyte abnormalities, sufficient to trigger a cascade of clot formation. He gazed at me from his hospital bed and remarked, "I believed I was maintaining good health. I did not anticipate that lettuce might affect me in this manner. It is distressing and more prevalent than one might assume. Particularly among individuals who consume evening salads alongside antihypertensive medications or those adhering to low-sodium diets that inherently diminish fluid retention. Romaine is not inherently malevolent, yet, in an inappropriate setting or moment, it may become the critical factor that your mind cannot withstand. Here are the key points to retain. Your physique at 70 or 80 differs significantly from that at 40. Minor fluid losses from diuretic meals, drugs, or inadequate nocturnal hydration can significantly alter your blood chemistry, increasing its propensity to clot, with the brain, reliant on consistent and stable blood flow, being the first to experience adverse effects. What actions should you undertake? If consuming salad at night, particularly romaine, ensure adequate fluids and contemplate transitioning your salad intake to noon when your body can metabolize it without affecting nighttime hydration. Carefully monitor your blood pressure, particularly if you are on diuretics. Leon recuperated, although it required months of speech treatment and physical rehabilitation, as he later informed me. I regret not being informed that even nutritious food adheres to guidelines as one ages. I am conveying this information to you now, not to instill fear, but to empower you. The forthcoming developments may astonish you even further. A ubiquitous kitchen vegetable appears innocuous and delicious, but, when consumed raw, particularly by the elderly, it can surreptitiously elevate blood sugar levels and impair cerebral blood flow during sleep. Indeed, I am referring to raw carrots, and what follows may fundamentally alter your perception of evening munchies. If you are now viewing and deem these insights beneficial, kindly comment 1 below to indicate your presence. Let us go to point number 4. For raw carrots, an inconspicuous enhancement for cognitive function. Initially, raw carrots appear to be an ideal snack. Crunchy, inherently sweet, low in calories, and frequently lauded for their beta-carotene content and vision-enhancing attributes. Numerous older individuals store them in the refrigerator as a guilt-free indulgence, a snack to have in the evening while viewing television, or as a nutritious substitute for chips or confections. However, the reality that most seniors remain unaware of is as follows. Excessive consumption of raw carrots or their ingestion at inappropriate times can subtly impair cerebral blood flow and elevate the risk of stroke during sleep. The carrot itself is not perilous. It pertains to the effects on blood glucose and insulin levels and their subsequent influence on the brain's vascular system, particularly post-age 65. Raw carrots, despite having a lower glycemic index than processed sugar, possess a rapid glucose load when consumed in isolation and uncooked. In younger persons exhibiting robust insulin sensitivity and consistent vascular tone, this is not a significant issue. In seniors, particularly those with prediabetes, type 2 diabetes, or impaired circulation, even a slight elevation in nocturnal blood sugar might initiate a perilous chain reaction. This is the outcome. You consume a handful of raw carrots prior to sleep, believing it to be a prudent snack choice. Your blood sugar increases within minutes. Your body subsequently secretes insulin to reduce the sugar levels. However, in numerous older persons, insulin responses are either sluggish or excessively vigorous. This may result in a significant decline in blood sugar levels overnight, referred to as nocturnal hypoglycemia. Although this may appear innocuous, it is not. During nocturnal hypoglycemia, the body reacts by secreting stress chemicals such as cortisol and adrenaline. These hormones constrict blood vessels, elevate blood pressure, and enhance blood coagulability, all of which pose risks to a brain already affected by restricted or rigid arteries. The abrupt increase in pressure, along with the nighttime dehydration frequently encountered by seniors, may result in the formation of microclots in the brain capillaries, potentially leading to a silent stroke or a transient ischemic attack, TIA. This precisely occurred with my patient, Mrs. Lila Henderson, 78. A former nurse from Portland. She was vigorous, smart, and took pride in preserving her health by natural means. She eliminated all processed sweets and substituted them with raw veggies, particularly carrots. She proudly informed me that it was her bedtime snack. However, Lila started to awaken some mornings experiencing discomfort, slight disorientation, dizziness, and even paresthesia in her hand. She dismissed it as merely a consequence of aging. One morning, she was unable to recall how to prepare coffee, a procedure she had performed daily for 40 years. Her spouse expedited her transport to the emergency room. What is the diagnosis? A minor yet genuine stroke, perhaps induced by nocturnal variations in blood sugar and vascular spasm. The laboratory results indicated erratic blood glucose levels and early indications of insulin resistance, while the vascular imaging revealed microclotting in the brain's small arteries. Lila confided in me that she believed she was acting correctly. I never anticipated that carrots may cause me harm. Her comments resonate with me to this day, as it is not about the carrot. It concerns the altered manner in which our aging systems metabolize food, and how the dietary choices that benefited us at 40 may subtly undermine us at 75. If you appreciate carrots, remain calm. Exercise prudence. Do not consume them uncooked and in isolation prior to sleeping. Combine them with protein or healthy fats during the day, such as hummus or a boiled egg, to mitigate the impact of sugar. Consistently with your physician on your evening dietary practices, particularly if you are prescribed drugs for blood glucose, hypertension, or cholesterol management. Lila recuperated. Fortunately, however, her autonomy was compromised and her assurance in her routine irrevocably transformed. She currently recounts her narrative to fellow residents in her retirement home, cautioning them against the seemingly innocuous behaviors that nearly resulted in significant loss for me. If you believe that carrots are the sole vegetable concealing such a risk, reconsider. Next, we will discuss a subject of significantly more potency. A vegetable regarded as therapeutic in numerous cultures. In older adults, it can significantly thin the blood, resulting in a single blood vessel rupture that could drastically alter one's life overnight. Indeed, I am referring to garlic. The reality may astonish you. 5 cloves of garlic. A natural blood thinner with concealed risks. Garlic has historically been lauded as a superfood. Historically, it has been utilized for ages in traditional medicine, esteemed for its ability to control blood pressure, reduce cholesterol, combat inflammation, and enhance immunity. Numerous seniors confidently incorporate fresh garlic into their diets or consume garlic supplements, convinced they are significantly benefiting their cardiovascular health and circulation. However, the reality that eludes most individuals is this. For elderly individuals, particularly those on anticoagulants, aspirin, or specific cardiac drugs, garlic may insidiously provide a risk for cerebral hemorrhage. A solitary clove may appear innocuous, yet within your aging body, it can shift the balance from safeguarding to jeopardy in ways that may go unnoticed until it is too late. Garlic is a powerful natural anticoagulant. It aids in the prevention of blood clot development, which appears advantageous. However, when used in conjunction with prevalent drugs such as warfarin, Plavix, Xarelto, or even low-dose aspirin, garlic may lead to excessive anticoagulation of the blood. For seniors with pre-existing frail cerebral blood vessels, this can be disastrous. I would like to introduce one of my patients, Mr. Thomas Reeves, an 81-year-old former train engineer from Missouri. Thomas epitomized self-reliance. Following a minor cardiac operation, he was administered an anticoagulant and advised to prevent hazardous interactions. He had read an article online regarding the therapeutic properties of garlic and resolved to consume a garlic supplement daily. 600 milligrams of pure garlic extract, along with an additional raw clove in his evening meal each night. He did not inform his physician. He believed it was inconsequential. 3 weeks later, Thomas commenced having intense cephalalgia and photophobia. Subsequently, nausea, disorientation, and dysarthria ensued. By the time his wife transported him to the hospital, he had already experienced a hemorrhagic stroke, characterized by bleeding within the brain. The brain scan revealed a rupture in a minor vessel that was expected to remain intact, but his blood was excessively thin to coagulate. Upon examining his medicine and supplement list, the source of the issue was evident. The issue extended beyond the medication. The culprit was the garlic. He informed me that he was merely attempting to assist my heart throughout a recovery. His voice diminished. I was unaware that I was preparing for this outcome. That is the tragedy. Thomas exhibited no warning indications, no chest pain, no falls, and no significant elevation in blood pressure. An imperceptible alteration in his blood chemistry until a little artery in his brain ruptured. The equilibrium gets exceedingly delicate at the age of 70. A single excess drop can inflict catastrophic damage. Comprehending this is essential. Senescent blood arteries exhibit increased fragility, rendering them more susceptible to rupture under pressure or in instances of poor coagulation. Garlic, particularly in supplement form, is significantly more concentrated than its culinary counterpart. One can easily underestimate the potency of a natural cure when integrated with contemporary therapy. This does not imply that garlic is detrimental. Nonetheless, it should be approached with the same caution and reverence as any medicinal agent, as excessive doses or inappropriate circumstances can covertly elevate the risk of hemorrhage in the bloodstream. Consult your physician prior to utilizing garlic supplements if you are over 65, currently on anticoagulants, or have a history of strokes or transient ischemic attacks, TIAs. Observe for indications of hemorrhaging, contusions, vertigo, unaccounted for cephalalgia, and, most importantly, do not presume that natural remedies are safe for a body undergoing the aging process. Thomas has returned home, but he now requires daily support and has experienced a loss of short-term memory. He is among those elders who, believing they were acting correctly, remained oblivious to the potential for good intentions to lead to disastrous outcomes in the absence of leadership. If you believe garlic is the sole concealed hazard in your kitchen, reconsider. Next, we will reveal a ubiquitous household vegetable, so commonplace that it resides in nearly every pantry, which can impair your equilibrium, disturb your cardiac rhythm, and insidiously induce cognitive fog or vertigo without your awareness. Indeed, I am referring to onions, and what follows may transform your culinary practices indefinitely. 6 onions. A decrease in pressure correlates with an increase in risk. Onions are among the most prevalent vegetables in American cuisine. From stews to salads, they are integral to our culture, tasty, economical, and rich in heart-healthy components. Numerous seniors incorporate onions into their everyday cooking, convinced they are making a prudent, healthful decision. That is frequently accurate when applied judiciously. However, for older persons, particularly those on antihypertensive drugs or managing cardiovascular diseases, onions may pose a latent danger to cerebral health, leading to erratic hypotension, oxygen deficiency, and perhaps precipitating thrombus formation. It may appear astonishing. In what ways might a vegetable recognized for its cholesterol-lowering and anti-inflammatory properties pose risks? The explanation resides in the interaction between onions and the aging vascular system, as well as the effects of their combination with drugs that already reduce blood pressure or serve as anticoagulants. Onions contain quercetin, a potent antioxidant that functions as a natural vasodilator, thereby dilating blood vessels and reducing blood pressure. Although it appears beneficial, administering your system with medication for the same purpose results in a compounded consequence. This may result in hypotension, a perilous decrease in blood pressure, particularly at night when the body is at rest and most susceptible. Hypotension may appear innocuous, although the alarming reality is otherwise. In older adults, a significant decrease in blood pressure, particularly during sleep, results in diminished oxygen and nutrition supply to the brain. This induces vasoconstriction, a reflexive restriction of blood arteries, as the body endeavors to safeguard essential organs. When vessels constrict excessively rapidly or irregularly, blood may coagulate, especially in pre-existing constricted or calcified arteries. Mr. George Langston, 80, a retired high school football coach from Georgia, saw this lesson firsthand. He had consistently been a strong proponent of alternative medicine. Following his physician's prescription of a beta blocker for hypertension, George resolved to augment the efficacy by natural means. For 2 months, he consumed a substantial portion of raw onions in a vinegar-based salad each night, convinced he was enhancing his cardiovascular protection. Initially, he experienced euphoria, more buoyant and vigorous. Subsequently, morning lightheadedness ensued. Vertigo upon rising from bed. One evening, he rose abruptly and lost consciousness, striking his shoulder against the table. The following morning, George was unable to recall the day. He mumbled his speech. His spouse expedited him to the emergency room. "What is the diagnosis?" "A little ischemic stroke." A thrombus had become stuck in an artery adjacent to the speech area of his brain. The blood pressure chart indicated considerable nocturnal declines, succeeded by reactive increases in the early morning. His physicians identified that his supplement usage, onion-rich diet, and drug interactions had excessively dilated and subsequently rapidly constricted his blood vessels. An optimal condition for thrombus development. George rehabilitated through therapy. Nonetheless, he is no longer capable of driving and occasionally had difficulty recalling names. "I intended to assist my heart," he informed me, "although I was unaware that I was depriving my brain. That is what I wish for you to internalize." With advancing age, our bodies exhibit increased sensitivity to variations in hydration, blood sugar levels, and particularly blood pressure. Foods that were beneficial at ages 40 or 50 may exhibit markedly different effects by ages 75 or 80. Especially when combined with prescription medications. Onions may remain a component of a nutritious diet, nevertheless, for elderly individuals on cardiovascular drugs, excessive consumption, particularly in raw form and during the evening, might precipitate hazardous declines in blood pressure, heightening the risk of thrombosis, disorientation, and potential stroke. If you experience dizziness upon waking, a sense of mental fog in the mornings, or observe unexplained bruises or unusual exhaustion, it may not be a consequence of age but rather an indication of excessively low blood pressure. Consult your physician, monitor your dietary intake, and use prudence with home cures. Your emotions and mind may not consistently concur on what is beneficial. If you believed onions were the sole common food that could subtly undermine your cognitive function, there is another that warrants your attention. A breakfast dish that is sweet and golden, yet can subtly elevate your blood pressure and disrupt your brain's rhythm. Next, we must discuss maize, and the narrative I am about to present may prompt you to reconsider your breakfast choices. If you are still engaged and deem these insights beneficial, kindly comment 1 below to indicate your presence. Otherwise, let us go to point 7. 7. Sweet and golden corn, yet subtly perilous. For many Americans, corn represents comfort food, whether presented as a warm accompaniment at a family gathering, incorporated into a robust soup, or even boiled and buttered for a comforting meal. Corn evokes a sense of familiarity and security. For several older folks, it constitutes a dietary staple they have relied upon for decades. What if I informed you that this lovely golden vegetable, particularly when consumed in specific manners, could covertly elevate your chance of a stroke during your sleep? Corn is frequently misinterpreted. Although it is classified as a vegetable, it functions nutritionally more like a starch, abundant in natural sugars that rapidly convert to glucose in the bloodstream. For seniors, particularly those with modest insulin resistance, hypertension, or vascular complications, this postprandial glucose surge is not merely an inconvenience, it poses a neurological risk. Let me discuss the physiological processes occurring within your body. Consuming maize, especially around dinner or near bedtime, causes a swift increase in blood sugar levels. Your body secretes insulin to regulate it. However, in numerous older persons, insulin exhibits diminished efficacy. Rather than a gradual decrease, glucose levels plummet, frequently during the early morning hours while you remain asleep. This abrupt decline compels your body to react with stress chemicals such as cortisol and adrenaline, which constrict blood vessels and rapidly elevate blood pressure. In younger persons, the body often adapts, but in those over 65, particularly if they have atherosclerosis or diminished cerebral circulation, this fluctuation can prove fatal. This combination of blood sugar instability and vascular stress creates an optimal environment for the formation of microclots in the brain's tiny arteries. That precisely occurred with my patient, Mrs. Darlene Abbott, 77, a retired librarian from Iowa. Darlene consistently led a simple life, engaged in reading, participated in church activities, and prepared meals from fundamental ingredients. Each morning, she consumed a bowl of corn grits adorned with a hint of honey. In the evenings, she relished corn on the cob with dinner, a nostalgic flavor from her childhood, she would assert. However, over time, she started experiencing fatigue in the mornings, dizziness upon standing, and occasional difficulties with concentration. Her blood pressure was inconsistent, normal one day and elevated the next. Subsequently, the morning arrived when her spouse discovered her gazing vacantly, incapacitated on the left side of her body. She experienced a small ischemic stroke overnight. Tests indicated increased fasting glucose levels, heightened blood viscosity, and microvascular damage in her brain. The primary factor was not merely age, but the consistent consumption of starchy, high glycemic maize, particularly during nocturnal hours, which disturbed her glucose equilibrium and contributed to the formation of microthrombi in the cerebral arteries. Darlene emotionally expressed, "I believed I was eating as my mother did. I was unaware that something seemingly innocuous could be detrimental to my well-being." The key takeaway is not the complete elimination of corn, but rather the necessity to acknowledge how your aging body processes it. Post-65, pancreatic function diminishes. Cerebral circulation becomes increasingly tenuous. What was formerly innocuous can now trigger a covert series of alterations that remain undetected until your body is unable to safeguard you. If corn is a component of your diet, such as grits, corn flakes, or corn on the cob, avoid consuming it in isolation or prior to bedtime. Accompany it with protein. Refrain from it during late hours. If you have diabetes, are pre-diabetic, or are on antihypertensive medication, consult your physician. The safety of your brain may hinge on it. If you believe maize is the final safe food that may become detrimental over time, reconsider. Next, we will examine a vegetable lauded for its sophistication and detoxifying properties. Nonetheless, it can insidiously deplete your body's fluids overnight, disrupt your circulation, and predispose you to a perilous fall or stroke before dawn. Indeed, I am referring to asparagus, and what you are going to learn may irrevocably alter your perception of your dinner experiences. Asparagus, tender outside yet depleting inside. Initially, asparagus appears to be one of the most nutritious vegetables available. Visually appealing, low in calories, and frequently included in heart-healthy or detox-oriented diets, asparagus has consistently received acclaim from medical professionals and nutritionists. For several seniors who have eschewed red meats or processed foods, it has become a fundamental component, particularly in dinner meals. However, underneath that image for purity exists a latent peril that most older folks are not cautioned against. Asparagus functions as a natural diuretic. It promotes the expulsion of water from your body, not only via digestion but also at the cellular level. This feature may be beneficial when exercised in moderation during daylight hours. However, when consumed at night, particularly by elderly individuals on antihypertensives, diuretics, or anticoagulants, asparagus might induce dehydration, diminish blood volume, and initiate a series of reactions that may result in thrombosis and potentially stroke. This is the reality of the processes occurring within the aging body. With advancing age, our bodies diminish their capacity to maintain hydration effectively. The sensation of thirst decreases, renal function reduces, and blood vessels, particularly the minute-sensitive ones in the brain, become more frail and less reactive. Consuming asparagus at night exerts subtle diuretic effects, extracting water from the bloodstream and gradually reducing blood volume during sleep. Although it may not appear grave, it is indeed significant. Reduced blood volume results in increased blood viscosity due to thickening. Consider your arteries analogous to garden hoses. The reduced fluid volume impedes the smooth movement of that fluid. Increased blood viscosity facilitates clot formation, particularly within constricted or aged arteries. These clots may not usually present with pain. They frequently develop inconspicuously, subsequently migrating to the brain and becoming lodged in a channel sufficiently wide to permit blood flow until it is obstructed. That precisely occurred with one of my patients, Ms. Joanne Ramsey, 79, a former school counselor from Colorado Springs. Joanne took pride in her healthful practices. She abstained from red meat, engaged in daily walks, and prepared almost all her meals from fundamental ingredients. Her preferred dinner consists of steamed asparagus garnished with lemon and a hint of olive oil. She informed me that it made her feel purified. Joanne was prescribed medication for hypertension and had a history of moderate atrial fibrillation, both of which elevated her risk for thrombosis. She consumed minimal water in the evenings, apprehensive about nocturnal potty visits. One morning, she awoke altered. She exhibited confusion, was unable to remember her address, and spoke with slurred diction. Her spouse promptly contacted emergency services. A CT scan revealed a minor ischemic stroke resulting from a clot that had been stuck in the brain's language center. Blood tests indicated increased hematocrit levels, signifying that her blood had become excessively concentrated. Her hydration levels were inadequate, and her physicians identified the correlation with her nocturnal asparagus consumption, exacerbated by diuretic drugs and inadequate fluid intake. The asparagus was not alone responsible, rather, its timing, frequency, and interaction with her medications culminated in a perfect storm. After weeks of speech treatment, Joanne made a recovery, but she shared with me a memorable insight. I endeavored to execute everything correctly. I was unaware that I was depleting my energy during sleep. This narrative is not intended to instill fear of asparagus, but to emphasize the respect warranted for the changes our bodies undergo after the age of 65. In youth, Renal function rebounds, vascular responses are efficient, and dehydration resolves readily. In advanced age, even mild foods might exert significant effects when combined with drugs and delicate circulation. If you relish asparagus, continue consuming it. However, refrain from consuming it late in the day without adequate hydration, and avoid combining it with other diuretics or anticoagulants without medical advice. Most importantly, heed your body's subtle signals. Initial indicators such as xerostomia, nocturnal vertigo, or awakening with lethargy may signify a more grave condition. Should you believe that asparagus is the final nutritious vegetable concealing risks, reconsider. Next, we will examine a vegetable frequently lauded for its advantages to ocular health and dermal condition. It is present in anti-aging treatments, multivitamins, and cosmetic creams. However, when ingested in excess, particularly by older persons, it can accumulate insidiously in the brain, replicate tumor-like symptoms, and jeopardize eyesight, memory, and autonomy. Indeed, I am referring to plants abundant in vitamin A, such as carrots and sweet potatoes, among others. The forthcoming revelation may constitute the most disconcerting fact of all. 9. Tomatoes, a stroke mimic concealed in your kitchen. For numerous elderly Americans, tomatoes epitomize freshness and energy. Whether incorporated into a summer salad, prepared as a sauce, or placed on a sandwich, they convey a sense of lightness, healthiness, and wholesomeness. For years, you have probably been informed that tomatoes benefit your heart, skin, and vision, and indeed, they do in numerous ways. However, it is likely that you have not been informed that for individuals over 65, particularly those with circulatory problems, neurological disorders, or digestive sensitivities, tomatoes can insidiously disrupt cognitive function, simulating stroke symptoms without prior indication. I will elucidate the process. Tomatoes have elevated levels of histamines, tyramines, and solanine, which, although benign for most young and healthy persons, may pose issues for elderly adults. Histamines and tyramines can induce inflammation, increase blood pressure, and alter vascular tone, particularly in the brain. Solanine, a neurotoxin included in nightshade plants, such as tomatoes, may provoke irritation of the neurological system when ingested in substantial or frequent quantities. The acidity of tomatoes can upset the balance of magnesium and calcium, two vital elements required for nerve function and vascular tone, so creating an internal crisis characterized by vascular instability, nerve disruption, and electrolyte imbalance. It is not surprising that for many elderly, a substantial tomato-based lunch may induce dizziness, headaches, visual abnormalities, slurred speech, and even numbness or weakness, symptoms that closely mimic those of a stroke. This is not merely theoretical. I have observed it occurring with my own patients. Mrs. Geraldine Hunt, 83, of Charleston, South Carolina, was among the most vivacious individuals I have attended to. A retired piano instructor with a passion for horticulture, she regarded food as a form of medicine. Each evening, she relished a warm bowl of homemade tomato soup, enriched with herbs and garlic, as part of her nightly routine. She believed she was engaging in a virtuous activity. She was not overweight. She abstained from smoking. Her blood pressure was adequately regulated, as she stated. One morning, Geraldine awakened in a state of confusion. She experienced an excruciating headache. Her sight was obscured. Her speech was slurred. Her daughter hastened her to the emergency room, apprehensive about a stroke. However, the scans revealed an absence of clots and hemorrhage. Her brain appeared anatomically sound, nevertheless. Laboratory results indicated a more complex situation, elevated inflammatory markers, electrolyte imbalances, and mild cerebral vasospasm, indicating that the blood arteries in her brain were contracting erratically. This was not a conventional stroke. It was a stroke mimic, a disease that resembles a stroke in symptoms and sensations, but is induced by chemical and vascular alterations, rather than an actual thrombus or hemorrhage. Upon comprehensive evaluation of her behaviors, clarity emerged. The evening tomato soup, along with her low-sodium regimen, slight dehydration, and aging blood vessels, had predisposed her to this event. Her brain was inundated with histamines, fluctuations in pressure, and electrolyte deficiency. A blood clot was not necessary to inflict harm. It only involved an inappropriate chemical reaction at an inopportune moment. Geraldine exhibited progress with attention, although did not achieve complete recovery. Her short-term memory was impaired, and she had anxiety related to eating. She expressed that she believed she was adhering to all the correct practices, yet her body no longer responds as it once did. The fundamental message I wish for all older adults to comprehend. Significant physiological changes occur in the body after the age of 65. Foods that were formerly therapeutic can now irritate, disturb, and potentially jeopardize your vascular system and brain. Tomatoes are not harmful, but, for numerous seniors, particularly those sensitive to nightshades, they should be consumed with caution. Refrain from consuming them late at night. Monitor for indicators such as edema, cephalalgia, or cognitive cloudiness. If you are prescribed blood pressure, cardiac, or nerve drugs, consult your physician regarding the potential effects of tomato products on your health. A single bowl of soup should not compromise your health. However, if you fail to heed your body's signals, it may indeed respond adversely. If Geraldine's narrative caused you to reflect, it is warranted, as she is not solitary in her experience. A significant number of elderly Americans are one meal away from an unforeseen health crisis, not due to fast food or processed snacks, but from meals they have relied on for years. What are the next steps? If veggies might present these concealed dangers, what is safe to consume? What is genuinely secure? In the concluding segment of this series, I will guide you through the protective measures for the brain, genuine senior-friendly meals that provide nourishment without adverse effects, and straightforward meal techniques that can enhance cognitive sharpness, maintain balance, and preserve independence. Ultimately, following all the apprehension and information, what we truly desire is hope. That is precisely what I will provide you next. Ultimate awakening, the potency of consciousness and the restoration discovered in simplicity. Upon learning about these 9 commonplace vegetables, each possessing their own concealed hazards, it is understandable to be astonished, if not slightly apprehensive. You may be contemplating how something you have relied on throughout your life has now turned perilous. Alternatively, you may be questioning the safety of consuming food at all. However, I wish to express this as plainly and empathetically as possible. This pertains not to fear. This pertains to knowledge. As a neurologist with decades of experience working with elderly, I have grasped a profoundly basic yet potent insight. Your physique after the age of 65 differs significantly from that at 40 or 50. Your blood vessels exhibit heightened sensitivity. Your hydration requirements fluctuate. Your drugs alter the manner in which food interacts with your body. Your brain, the most delicate and essential organ, relies on consistent and reliable assistance, particularly during sleep. Occasionally, the meals you perceive as beneficial may be subtly causing harm. Every patient narrative I have recounted, from Leon, who fainted after consuming romaine nightly, to Marlene, whose asparagus consumption led to cerebral dehydration. These instances are not uncommon. These are ordinary elders endeavoring to act appropriately. Individuals of integrity, intelligence, those who scrutinize labels, use vitamins, and adhere to their physician's recommendations. However, they lacked one essential element: context. Health encompasses more than merely dietary choices. It pertains to the timing, methodology, and accompanying elements. It involves comprehending the interplay between your medications, hydration status, blood pressure, sleep patterns, and the food you consume. This pertains particularly to the manner in which your brain reacts to these decisions as you age. Coagulation occurs readily in viscous blood. Pressure transitions overnight. Vessels that once exhibited flexibility now exhibit rigidity. Consuming foods that thin the blood, elevate blood sugar, lower blood pressure, or induce dehydration, even those marketed as heart-healthy or clean, may inadvertently heighten your risk of stroke, memory impairment, or cognitive deterioration. However, there is positive news. You possess agency. In reality, the contrary is true. Awareness constitutes a form of medicine. Your decisions regarding your newfound knowledge will determine the moment of transformation. What are your current capabilities? Commence with simplification. Revert to authentic, unprocessed, nutrient-dense foods reminiscent of those consumed by your grandparents. Consider cooked leafy greens such as spinach, consumed in moderation. Berries, almonds, hydrating fruits such as melon, and lean proteins that offer consistent energy without abrupt fluctuations. Consume your more substantial meals earlier in the day. Do not neglect hydration during the night. A modest glass of room temperature water prior to sleep might significantly impact well-being. Most essential, consult your physician. Incorporate this knowledge into your appointments. Pose inquiries. Is this supplement compatible with my medications? Ought I to refrain from consuming this dish in the evening? Is this veggie excessively anticoagulating my blood? An exemplary physician will not disregard your apprehensions. They will assist you in modifying your habits to accommodate your evolving physique, rather than conforming to an external benchmark, as you are no longer the individual you were 3 decades ago. That is acceptable. You are now more astute, seasoned, and adept at heeding your body's subtle signals before they escalate into urgent demands. I contend that you merit more than only additional years to your existence. You merit lucidity, agility, recollection, and assurance. You merit mornings devoid of dizziness and evenings free from perplexity. You merit a brain that functions effectively, not one that diminishes in capacity due to little matters such as a salad or a snack. I encourage you to take a little step today. Consider relocating your salad to lunchtime. Consider examining labels for vitamin K or salt content. Perhaps you simply pour an additional glass of water before retiring for the night. Regardless of the circumstance, ensure it is deliberate. Allow it to emanate from a position of power, not trepidation, for you are not delicate. You are becoming cognizant of your consciousness, your insight, and your capacity for action. That is what now safeguards your brain. If this message resonated with you and prompted you to contemplate even a minor habit, then I feel it has already initiated a positive transformation. One is never too advanced in age to safeguard their future. It is never too late to become your own foremost advocate. One is never too knowledgeable to continue learning, particularly when one's intellect, autonomy, and existence are at risk. Consider this your awakening signal. May this forthcoming chapter, characterized by improved decisions, safer practices, and profound comprehension, be the most empowering thus far. These lectures aim to motivate you to live completely and genuinely. I would appreciate your response. Reflect briefly and articulate one lesson you have acquired that you intend to implement in your life. Let us assist one another in this endeavor to accept these truths. If you appreciated this video, kindly leave a comment with 1. If not, please feel free to remark with 0. Your comment is highly valued by us. Please remember to like, share, and subscribe to our YouTube channel for other stuff of similar nature. Thank you for viewing, and may you embrace life according to your own principles.